All this is Dr. Mobeen Sayed. Welcome to one more talk. So instead of just doing question answers, I wanted to discuss how we can reverse diabetes and what are various methods. The reason for this is, as I did the video yesterday on the other channel, talking about weight loss and management of diabetes with that, there were many comments that were that I cannot lose weight, or I have tried to lose weight and it has not worked, or losing weight is a lot of effort and I just cannot do that. So I thought I'll present all the studies that show various methods to lose weight, or not, sorry, lose weight, to reverse diabetes. So that's what we are going to do, so that if you can lose weight, good. If you cannot lose weight, then maybe reducing inflammation. If you cannot work directly with the diets that would reduce inflammation, then some way to de-stress yourself so that the pancreatic cells can become redifferentiated, or intermittent fasting, or the alternatives to intermittent fasting, or supplements that mimic intermittent fasting. Similarly, there are foods that mimic fasting. So all those are methods that you can experiment with to figure out which one is it that would help. Generally, healthy food will be the key to reversing diabetes. And I feel with the modernity in medicine in this day and age, it is actually not the best approach to look at diabetes, type 2 diabetes mellitus, as only manageable and will be chronic progressive. That is, it is going to continue to increase. Instead, we should look at that as how do we reverse that? So that is what I want to do today. So my apologies, not a lot of question answers, at least until I can present these studies to you, and then we can do question answers if we have time. So with this, welcome to everyone. Let's start our discussion. Actually here. So before the blank canvas, here. So the first type of the way, first method, this is what we discussed in the video on the other channel, that is primary care-led weight management for remission of type 2 diabetes. I did this video yesterday. You can watch it on the other channel. The point in this video is, and let me just quickly show it to you. Let me increase the font here. That they said 86%. Check out this line, just this line. Those who reduced 15 kilogram or more within 1 year time frame, they were able to, 86% of them had diabetes reversed. Now, again, there are 14% whose diabetes was not reversed. So it is not necessary that everybody will. But you can see it is a big number, 86%. Especially if somebody is diagnosed with diabetes within the last 6 years. So it is very important that somebody who becomes pre-diabetic or is recently diagnosed for diabetes, for them to make every effort to reverse it. It is not necessary to live with diabetes and its secondary aspects, for example, renal failure or neurological issues or immune system issues or cardiovascular events. One, instead of taking those pains, we should do everything we can to reduce our weight. So that is one. Now imagine if somebody says, I can't reduce weight, or I'm lean mass and I have type 2 diabetes, or I have tried and the weight reduction has not helped. Let's look at the other methods. I'm going to go to this one. This is the Banting Lecture Award, Hyperinsulinemia, Cause or Consequence. This is Dr. Barbara E. Corky's work. In this work, what she said was, she didn't go towards the weight management. She did acknowledge in this paper that as we become diabetic, we start gaining weight because there is insulin resistance. That means the glucose cannot enter the cells very well, and the liver would then have to process that, and the fats are formed, and those fats would start going and getting accumulated. So fatty liver, fatty pancreas, and fats generally in the body will become accumulated. However, she points out something else, and I have done this discussion in the past. I'm just going to review it for you once more, some parts of it, to convey the message. And here she's not going to talk about weight loss. What she's saying is the following. Let me give you the summary first. What she's saying is that in our modern day foods, in the foods that we take today, modern industrial scale foods, they have more than 4,000 inedible dietary agents. She calls them agents. She doesn't call them ingredients of the food. Ingredients are edible. These are not edible. So what are these things? Food colors, preservatives, emulsifiers, unwanted plastic pieces, unwanted packaging pieces, all those things and more would enter our food and then eventually us. These agents, what they do is, as they interact with the cell, so let's say this is a beta cell, and this is true for any cell. I'm just using beta cell because that is the most important for the context of the discussion today. So let's say this is the beta cell. We know that beta cell's job is to get glucose in it, and with that glucose that is present, it will sense the amount of glucose present in the environment and then produce a corresponding level of insulin molecules. Correct? Imagine if this one beta cell is representative of all the beta cells in the pancreas. These agents, when they enter the beta cell, what they do is they cause irritation. They cause reactive oxygen species production. Reactive oxygen species production would in turn agitate this cell. How would that do it? Number one, these reactive oxygen species are like little bullets that are going to hit various parts of the cell and the enzymes of the cell. Secondly, the reactive oxygen species are going to enter the nucleus as well. Thirdly, as the reactive oxygen species are damaging cells structures, there are going to be stress signals that would go to nucleus that the cell is under stress. The result of that is that the cell would start producing extra amounts of insulin because the cell is agitated. Just like if a muscle cell is agitated, it twitches or it contracts. When a nerve is agitated, it creates aberrant signals. We call those signals paresthesias when it is sensory system. When it is muscular system, we start developing twitches and involuntary muscle activity. Here, when the beta cell is agitated, it starts producing insulin. That bombardment of insulin on other cells. So let's say this is a GIT cell. This bombardment of insulin on the other cell causes the other cells to downregulate their insulin receptors. These cells say, there is a lot of insulin in the environment. We do not know why, but we cannot work with so much insulin. And the result is they would start downregulating their insulin receptors. The result of that is insulin resistance. So now think about it. The beta cells are agitated. It doesn't matter if there is glucose or not. And that is your key here. That it is not about reducing carbohydrates. The Banting Award lecture here, the one that we are discussing, this is another method of reversing diabetes. Here, she's not focusing on the glucose. We should, but she's not focusing on the glucose. She's saying in our food, there are agents that irritate the beta cell and cause hyperinsulinemia. Hyperinsulinemia, number one, would of course cause lots of fat production from liver. So if it was a liver cell and that cell is receiving a lot of insulin, that liver cell is going to start storing glucose into the form of glycogen and fats. Those fats are then going to start coming out of the cell. They would store inside the cell and the fatty liver would develop. Then these cells would go to pancreas and fatty pancreas would develop. These cells would go and get stored in various fat tissues as well, and the weight gain would occur. These fats would then cause insulin resistance as well. So now there is a person who has hyperinsulinemia, who is gaining weight, who has become insulin resistant. Now, this person who's gaining weight has not yet become diabetic, but has hyperinsulinemia, will start having hypertension as well. Why? Because insulin, when it works on the renal tissue, on the kidney tissue, in the kidney, insulin causes sodium retention. The sodium chloride, the salt that we eat, the sodium we throw out from the kidney, and the water goes out with sodium. When we retain sodium, when we keep it back in our body, then water stays with that as well. That would cause our fluid volume in our body to expand. So that is one problem. Second problem is that insulin causes release of epinephrine, which is a stress hormone. Epinephrine in turn causes vasoconstriction. So the blood vascular diameter reduces. Insulin also causes another hormone, aldosterone, to be released, which causes further sodium and water retention. All of that together, that is vasoconstriction with water and sodium retention, cause hypertension. Insulin, in fact, can directly work on the blood vessel walls and cause constriction of the blood vessel directly by acting on their smooth muscles. Insulin also reduces the nitric oxide production. Nitric oxide is a molecule that is necessary for blood vessels to dilate. Remember, in the cardiac problems, they give nitric oxide. So when the nitric oxide levels are low, then the blood vessel would constrict as well. So there are so many mechanisms by which insulin would cause vasoconstriction and fluid expansion, leading to hypertension. So she's not talking about the glucose. What is the solution here? How do we cure this hypertension? How do we stop this weight gain? And how do we reverse this diabetes if this patient starts becoming diabetic? Simple. Better foods. Less processed foods. Foods that would produce less reactive oxygen species. Foods with less emulsifiers. Foods with less colors. Foods with less preservatives. Foods that are not packaged. Because packaging itself adds molecules to the food. Ultra-processed food they involve warming the product or heating the product. A heated product also would develop advanced glycation end products or age. These advanced glycation end products also cause inflammation of the cells, including beta cell, causing insulin release. So here is our second method to reduce and reverse diabetes, and that is by reducing hyperinsulinemia, and that is by eating healthier. So that is the second method. First method, lose 15 kilogram of weight. Second method, eat healthier foods. And you can think of combining them as well. But I wanted to show you individualized methods, and you could opt for any one of them, and that would help. So better foods, less processed foods, foods with less reactive oxygen species, foods that are less inflammogen. So let's now, with this background, let's read a little bit of what she's saying. Food is different today than it was in the past. Over 4,000 new agents have entered our food supply, intentionally or inadvertently. Almost none of those have been evaluated as potential cause of obesity or disease. Then she says the average weight has more than doubled. The feed efficiency has increased. So when we process foods, the efficiency of these foods to give us nutrition increases almost threefold with a decrease in mortality. The mineral content of fruits and vegetables has changed over the past 40 years, probably because of optimized and standardized growing conditions. The packaging and preparation of our food have also changed, leading to an increase in non-edible packing material in the food, non-edible packing materials. These were not supposed to be in the food, but they are in the food. Many foods contain preservatives, emulsifiers, flavor enhancers, food coloring, and other fillers that have not been previously consumed in significant quantities. So, here she's saying, and this is published in Diabetes Journal. So it's not some, article on the site somewhere. My model proposes that environmentally induced elevated background levels of insulin superimposed on a susceptible genetic background or basal hyperinsulinemia is the root cause of insulin resistance, obesity, and diabetes. So she starts with more insulin because of bad foods, which then lead to obesity and diabetes. So logically, the answer is going to be to correct the foods, right? However, there is evidence that hypersecretion of insulin can precede any cause insulin and cause insulin resistance, precede the diabetes. Furthermore, in human studies, inhibition of hyperinsulinemia with diazoxide actually causes weight loss and decreases insulin levels without impairing glucose tolerance in obese humans. So in obese individuals who may have become obese, one, for the genetic predisposition, and secondly, because of hyperinsulinemia, if you control hyperinsulinemia in them, then their diabetes start becoming controlled even if they have not lost weight. This is also evident with the bariatric surgery. In the bariatric surgery, as soon as the food intake reduces, as soon as they tie the stomach and reduce the size of the stomach and the intake reduces, patients' body weight doesn't go down immediately, but their insulin dependent diabetes type 2 reverses within 2 to 3 weeks. So if it was just the fats, then they should not have the insulin, the diabetes reversed, because the fats are still there. The patient would lose fats in 6 months or more. These studies suggest that hyperinsulinemia can cause insulin resistance and that lowering insulin secretion in hyperinsulinemic individuals may be beneficial. The proposed new model is based on the hypothesis that excessive beta cell secretory responses, possibly by environmental agents, factor X she calls them in this diagram, may be a contributing or major cause of obesity and type 2 diabetes. And here, this is the factor X. Imagine this is an emulsifier, preservative, food color, something, packaging, pieces of packaging. That causes beta cell to hypersecrete. Beta cells are part of pancreas. They secrete insulin. So when they hypersecrete, what do they secrete? Insulin. That causes insulin resistance. All of that leads to obesity and diabetes. So if somebody is overweight, has diabetes, has hypertension, and they cannot reduce mostly using industrial foods. The best solution to reverse diabetes is to correct the food. So this is the second method. So weight loss is one method. Food correction or healthier food is the second method. They can combine as well. Now I want to go to the third method, inflammation. And I have discussed this in the past as well. So let me just very quickly go to the third problem that can give rise to diabetes and how we can handle that. So once again, imagine that this is a beta cell. In the beta cell, as we continue to age and as we have been eating foods that produce reactive oxygen species, those reactive oxygen species attack. So let me make eyes in this cell. This should be a sad cell, right? These reactive oxygen species attack various enzymes. They attack DNAs, RNAs, ribosomes, other parts of the cell, cause misfolded proteins. Misfolded proteins. I discussed that a few days ago as well. I'm just putting all of these methods in one place today. I think this would be the most important lecture in terms of the methods to reverse diabetes, because even for me to do this lecture, I had to go back and collect all those studies. So it is not necessary that everybody has access to all those studies. So here these are in one place. Misfolded protein aggregates. When these accumulate in the cell, these cause inflammation because these are stressful products. They cause the cellular environment to be disrupted, and the nucleus will know that it is under stress. And the result of the stress is that the nucleus would start producing inflammatory molecules. And those inflammatory molecules would not only affect this cell, but the neighboring cells as well. So now the patient has inflammation. That inflammation of the beta cell would cause, as you saw before, that if you have a lot of reactive oxygen species, you would end up, or the person would end up producing a lot of insulin. So the remaining mechanism is understandable that now there is inflammation, there is a lot of insulin production, and we have hyperinsulinemia, which then causes insulin resistance, and we have diabetes. How do you handle this situation? Where there is misfolded protein aggregates present in the cell, you do intermittent fasting. And we have done this discussion before. Intermittent fasting will activate autophagy mechanisms in the cell. Those autophagosomes will start eating away at this trash. I'm calling this trash the misfolded protein aggregates. So as we start clearing these protein aggregates, the cell starts becoming normalized. And I've done this discussion before as well. Our cells are new and pristine all the time. We continue to make new cell membrane pieces. We continue to make new organelle pieces. Organelle are the things that are within the cell. We continue to make repair DNA. We continue to make new messenger RNAs. We continue to make new enzymes. We make an enzyme, we use it, we break it down, then we make it again when we need it again. The cell is always young and healthy. You are 50 or 60 or 70 or 80, your cells are young. It is what is inside the cell that is a problem. So you handle that. How do you handle that? Intermittent fasting. Now, in the intermittent fasting, people generally end up losing weight as well. However, the point of intermittent fasting is not to say lose weight, but the point of intermittent fasting is to cause autophagy, which would clear the cells of this trash. And when a cell is cleared, the cell will work better. So this is your third method. And for the intermittent fasting, it is not necessary that you have 3 days water fast or you have 2 days or 48 hours fast. Intermittent fasting can be started by remove snacks from your daily habits, start compressing the meals together towards each other, maybe delay the breakfast a little, maybe pull the dinner a little earlier, then maybe skip a meal or replace a meal with more fasting mimicking diet, meaning things that do not have much nutritional value, things that the foods that do not have a lot of reactive oxygen production uh, or reactive oxygen species production potential, healthier food, but less nutritious food, which would then just make you feel full. You will not be hungry, that you're not craving food, but body is actually hungry because it is not giving food or nutrition. And that would help. In the case of this study, I have shared this study many times. This is Dr. Jason Fung from Canada, nephrologist who has been discussing autophagy and intermittent fasting for decades now, or at least more than 10 years. This is where he did therapeutic intermittent fasting, and people who were dependent on insulin, type 2 insulin dependent diabetics, their diabetes was reversed within 3 weeks with intermittent fasting. You're not losing weight. I mean, in 3 weeks, you're not going to lose 15 kilogram. They were just reducing their food intake, producing a state of fasting in the body, which allowed the autophagy to happen. And this trash in the cell started getting cleared out. Doesn't matter if you lost weight or not. As soon as this starts getting cleared out, the cells start functioning correctly and the patient is gotten the diabetes reversed or corrected. I have mentioned this study many times. That is why it is highlighted. But if you see here, look at this. Patient 1, 40 years, male, years with type 2 diabetes, 20 years. The very first study with the weight loss in the UK, that study said that if you are diagnosed within the last 6 years with diabetes, type 2 diabetes, then losing 15 kilogram, that also means if you are overweight, that can 86% of the people have diabetes reversed. In this study, these are individuals who are insulin dependent, who are diabetic for 20 years, 25 years, 10 years. And what was their diet? One day dinner, low calorie, but dinner. The other day, lunch and dinner. So there was no single day with the full fast. Dinner one day, lunch and dinner the other day. And the patients within 3 weeks, look at this, all patients followed similar dietary regimen. Patients 1 and 3 followed alternating day 24 fasts, and patient 2 followed the tri-weekly 24-hour fast. Tri-weekly, just 3 days. On fasting days, the patients only consumed dinner, whereas on non-fasting days, the patient consumed lunch and dinner. Low carbohydrate meals were recommended with eating meals. Patients when eating meals. When patients were examined on average twice a month in labs. So outcomes. Look at this. The most noteworthy outcome from this case series is the complete discontinuation of insulin in all 3 patients. The changes in diabetic medicines in all 3 patients are summarized below. Both patients 2 and 3 discontinued all diabetic medications entirely. Patient 3 discontinued 3 out of 4 medications post-fasting regimen. All 3 were able to discontinue their insulin. The minimum number of days to discontinuation of insulin was 5, and the maximum was 18. So, of course, nobody was going to lose weight within 5 days or 18 days. It is an entirely different method. Right? And what is the underlying mechanism? What is the crux of this structure, this method? Is autophagy. Now, if somebody said, I cannot do intermittent fasting, then they can take supplements or foods that can trigger autophagy. You can easily Google foods that trigger autophagy. These will be fasting mimicking foods. And there are supplements like resveratrol and other, spermidine, urolithin A, etc. So there are supplements, there are foods, there is lifestyle. We have done this discussion before. Sauna causes heat shock proteins to be activated, and the heat shock proteins, when they are activated, they start autophagy. Cold treatment causes heat shock proteins to be activated, which will then cause autophagy. Right? So it's not necessary that you have to do intermittent fasting, but that is the best if you can. Otherwise, there are other ways to mimic intermittent fasting or trigger autophagy. This is your third method. There's no weight loss. Nobody's going to lose weight in 5 to 18 days, but they discontinued their insulin within 5 to 18 days of doing this. So that is your third method. Fourth method is reducing inflammation, and reducing inflammation causing habits and foods. And how does inflammation cause the problem? This is a different mechanism. That mechanism, I discussed this a few days ago. This is a study, 1st January 2024. Easy H2 inhibitors promote beta cell-like regeneration in young and adult type 1 diabetes donors. So what did they talk about? Do you remember this one? This one was really simple. What they said was, and this is a new understanding of beta cells. What they said was that imagine this is a beta cell. This beta cell is doing its regular function, producing insulin, measuring glucose, going about its business. We sent in bad food. We made it fatty. We caused misfolded proteins. We created other kind of stresses on it, whatever that stress is. If there is inflammation in the environment, for example, long COVID, vaccine injury, they cause inflammation. Many other autoimmune diseases cause inflammation, chronic inflammation, right? When the inflammation is present, either because of the food or because of a pathogen or because of an intervention, the end result is there is inflammation. And this study showed that when there is inflammation present in the system, beta cell of the pancreas, they try to protect themselves by becoming non-functional. So that was, I discussed it a few days ago, that is called differentiation. Differentiation of a cell means that when the cell is formed from its parent cell, all of our cells come from some parent cell, right? When a cell is formed from a parent cell, and the parent cell, let's say this is a parent cell. This is a stem cell, right? So this is a stem cell that is the parent of this beta cell. When a cell becomes another cell, when a daughter is born from a stem cell, the daughter cell can commit to do something. This one cell is saying, I'll become the beta cell. I'll release insulin. I'll measure glucose. Some other cell would say, I'll become a muscle cell. Some other cell would say, I'll become a bone cell. I'll become a liver cell. I'll become a skin cell, and so on. That is called differentiation. The daughter cell is differentiated into a role-playing cell. This is just like our babies, our children. When they grow up, somebody becomes a doctor, an engineer, and a finance person, and so on. Under inflammatory stress, the beta cell de-differentiate. They get back to their parent type. They close their genes that make insulin, and they stop their function. They close their shop, and they become parent-like again. Why do they do this? The researchers think that this is probably because the beta cell are trying to avoid stress by getting back into the parental structure. We used to think that the beta cell just disappeared, they die. This is why we used to say, by we, I mean medical community, they would say that the diabetes is a chronic progressive disease. Beta cell would continue to die and will continue to become more and more diabetic. But here, beta cell is actually not dying. They are de-differentiating into their parent cells. They are sitting there hiding. They are taking cover from inflammation. So when you reduce inflammation from them, the beta cells redifferentiate. They redifferentiate. They become functional again. And they start functioning. That means normal function again. That is reversal of type 2 diabetes back to normal. And what is the condition here? What do we do? Reduce inflammation. This is why today our medical community has to understand to control patients' inflammation, control their chronic inflammatory state, so that this kind of a structure does not happen. This kind of outcome does not happen. Because think about it for a second. Once the beta cells stop working, become their parent type, we do not have enough insulin now, and the insulin reduction would then start causing the glycation. Because glucose is present, it cannot get into the cells. That glucose is going to start sticking to everything around in the tissues and blood vessels, causing hypertension, causing diabetes, nephropathy, neuropathies, immune system dysfunctions, cardiovascular events, hypertension, strokes, heart attacks. And what was underneath to control? Inflammation. Alexander says the human body has amazing self-repair ability. Absolutely. Embol says, I think we need a better definition and understanding of inflammation. Absolutely. Embol says walking temporarily increases inflammation. Temporary increases inflammation, the bursts of reactive oxygen species, actually allow our cells to heal and become better and become hardy. It is the continuous bombardment of inflammatory state, the chronic inflammation, chronic inflammatory state is devastating for our bodies. And I hope I can make this one message clear. Sometimes I think I have not been able to deliver my message, and that is, our cells are always new. This statement that as we age, this happens is actually not the correct statement, or it doesn't tell the whole story. Yes, it is true, as we age, dysfunction happens, but not because the cells have become bad, but because the cells are under attack by misfolded protein aggregates. They are under attack by inflammation. And as these cells experience these problems, they themselves become inflammatory. And that is how we go down. And how do you break this cycle? Reduce inflammation. Do autophagy. So now we have 4 methods in front of us. I'm going to very quickly go through them, whichever method works. The first method was weight loss, right? 15 kilogram weight loss, 86% type 2 diabetics, non-insulin users, diagnosed within the last 6 years, 50 plus, I think they were 40 to 65. They had reversal or remission, 15 kilogram plus weight loss. That is number one. And if you watch my video, if you go to see that video on the other channel, there are people who are saying, I cannot lose weight, or I lost weight and it didn't help, or I am lean body mass, and so on. So this is one method. Second method, better food. Dr. Barbara E. Corke's research. Better food, reduce insulin levels, reduce diabetes, reduce obesity. But here, the first to come is not obesity or weight. The first to come is better food. Third, intermittent fasting to cause autophagy. The base mechanism here is autophagy. However, you can trigger that. Intermittent fasting or fasting mimicking foods, or some supplements that can trigger autophagy, or temperatures, extreme temperatures, saunas, cold, etc. Whenever our cells are under stress, they trigger autophagy automatically. So that is number 3. Number 4, help the beta cells become redifferentiated from their stem cell state back to the beta cell by reducing stress on them. Now, this stress can be that a person is psychologically stressed and they are releasing stress hormones. So that would have to be taken care of. Or there is stress of inflammation because of the kind of foods, or because of chronic diseases, or because of chronic inflammatory states for whatever interventions, etc. So this is what I wanted to make sure that today we can get across, that there are multiple ways to reverse diabetes. The basic idea, we have to work to reduce and reverse diabetes and not live with it as a chronic progressive disease. So here, this is the, in this one, what they did was they used these drugs. This is called TAS drug. They used this drug. So what they did was they took cells from the patient, exposed them to TAS in lab. These cells converted back to the beta cell type. They cultured them and put them back in the patient, and patient had a normal functioning beta cell population. So then if you see here, beta cell differentiation in diabetes is important, but what is it? So I just explained it. This is another study over here. Then here, if you see this is the therapeutic use of intermittent fasting, look at this one. The role of inflammation in diabetes, current concepts and future perspectives. All of these links are present in the description of this video. That is the basic teaching part of the discussion I wanted to do today. So we can either do chit chat, or my recommendation is we stop here so that this piece of video becomes useful for reversing diabetes only, and there is nothing else in it. So that way people can easily share it and watch it. I'll go with your recommendation. What do you think? Shall we stop here today so that we have this package of ways to reverse diabetes, and then we can do chit chat at another time. Yeah, cool. So, hey Mipalart, hey Jean, thank you very much. Okay, so we stop here today so that this video just contains the ways, the methods to reverse diabetes one way or the other. Not necessary that everybody has to lose weight. And please like, subscribe, and share with others as well. This is actually useful. Diabetes is one of the most prevalent disease. And please remember that in the US, 62% of the population has chronic diseases attributable to inflammation, including diabetes. And diabetes is quite a killer as well. So with this, thank you very much. Please share it with others, and I would see you next week.